Over 100 staff at the Dr Pixley Isaka Seme Memorial Hospital in KwaMashu, KZN, are on strike. Their grievances range from poor working conditions, security and non-payment of overtime. Now, that's where we find Lethiwe Mdluli, who joins us now for the latest. Lethiwe, we know that they've already handed over their memorandum of grievances, but patients will obviously be impacted by this tools down. What are the workers' representatives saying about what's going to happen to the hospital today?
Well, Maseko, fortunately, the staff has gone back to work, but a few hours ago, workings at the hospital were affected because a lot of staff, more than 100 members, were outside picketing, and they handed in their memorandum to the Department of Health officials. Some of the grievances that the staff have raised have to do with working conditions at the hospital. They are saying that there's poor working conditions. Some of them have to work the whole day without taking a lunch break, and when they attempt to do so, their matrons will raise issues with this. They are saying that they are overworked, and they are calling for the health department to hire more staff. They're saying also that some people have been demoted from their jobs. They were hired for a certain job, but then they'll find that they've been demoted without HR knowing, which means that they're not being paid their exact salaries. So these are some of the issues. But another concerning thing is with security. Some of the staff members have actually shared with us that a few weeks ago they were blocked from entering the hospital from some of the community members in KwaMashu, who are claiming that they stole jobs from locals in that township. So they are now fearing for their lives. They're saying that also there is no accommodation for nurses who are working at night. So there's a list of endless grievances that the staff has handed in, and unfortunately they are saying that the Department of Health here in the province has failed to respond to them, and this is why they've taken the decision to picket outside. When we were at the hospital a bit earlier on, we saw that patients were waiting. Unfortunately, they were not being assisted because of the pickets, but right after the staff handed in their memorandum, fortunately enough, they went back to working. They did say that they did not want to interrupt any workings of the hospital, but unfortunately, because they've raised these issues for so long without getting any answers, they took the decision to do this. But when we spoke to the PSA, the union that has been representing some of the staff members a bit earlier on, this is what they had to say.
So we are saying people work 7 hours at the theater without taking break because there is a shortage. There are emergency cases that they need to attend. Now even the management refused when they need to go on that as per Section 14 of the Basic Condition of Employment Act. How do you allow people to work 7 hours without a break? They can't leave patient. They've got cases that they need to attend. So what we are saying, the MEC has done very well in converting contract workers to permanent here and appoint over 1,000 rand. But this management is messing up. This management think we can be controlled by them. Workers are tired. We are saying now is the time to say workers must unite.
Well, that PSA leader, Lethiwe, is saying that they've raised this a number of times. You also said that in your previous answer. So that means the Department of Health should know about this. So what was their response to this matter?
Well, right now, Maseko, we're trying to chase a response from the Department of Health, but unfortunately here in KwaZulu-Natal, the department is not very forthcoming. They are never available to answer any questions, and we have called them today, and they are promising that the HOD will be responding to us, but there were health officials a bit earlier on that were at the hospital who received the memorandum, and they are saying that they are aware of what is currently happening, and they will be responding to some of the grievances in that memorandum. The union has given the department 10 days to respond, and the department or the health officials that were there to receive the memorandum did promise that they will respond back in those days. We are still waiting for comments from the HOD here at the health department, but unfortunately I'm not going to promise anything because they do not come back to us when we do try and speak to them. But when the health official earlier on was receiving the memorandum, this is what he had to say.
So what we're going to do, we're going to go through your memorandum and see what things that the institution can respond on, and we'll prepare a response to the PSA in a specific time as you requested. But there are other matters that will need the intervention of the provincial office. We will request the necessary managers to come and give the response on that. But we commit that within the specified time, we will communicate back to you, PSA, and pave the way forward. But we have to encourage shop stewards that when there are issues, do not take issues personal, raise issues with us. I communicate with your PS in many times. So we are learning for the first time that there are challenges in this institution.
All right, Lethiwe Mdluli live for us there in Durban.